In this video, we're going to be talking about chronic diseases. This is the only video you need to watch for Chapter 4 for developmental psych. And I'm just going to get some definitions out for certain types of chronic diseases, including osteoporosis and a couple forms of dementia. And then in class, we'll go more in depth on risk factors, treatments, all of that fun stuff. But first, you should know what a chronic disease is. If it's a chronic disease, it means it has a slow onset and a long duration. So these do not pop up just overnight and turn out horrible. They come on slowly. There's also a difference between men and women when it comes to chronic diseases. For men, they tend to have more fatal chronic diseases, whereas women are going to have more non-fatal chronic diseases. So, for example, men are more likely to have like a heart condition, whereas women are more likely to have potentially arthritis, something that won't kill you, but it's still going to fit in that chronic category because it comes on slowly and it lasts a long time. Another factor connected with this, something that's correlated with chronic disease, is income level. So the less income you have, the more health problems you have, like chronic disease, when you're in late adulthood. So your income level throughout your life will affect how healthy you are as an adult. The more income you have, the better your health. So again, just a few chronic diseases to go over. The first one, osteoporosis. Osteoporosis, a no goes there too, is when you have bone tissue loss. So this is an aging disorder that involves extensive loss of bone tissue. And again, different groups are more likely to get osteoporosis. Postmenopausal women are more likely to get it. Women who are thin or small boned are more likely to get it than women who are not as thin. You're also more likely to get it if you don't exercise and if you smoke. All of those are risk factors for osteoporosis. Another chronic disease that will go much more in depth in class is dementia. And there's a couple of forms you need to know. Overall, dementia is a global term for any neurological disorder causing mental deterioration. So if you have dementia, you can have a specific type of dementia. It doesn't mean it's not dementia, it just means it's a specific type. So dementia has a lot of different types to it. And about 20% of people over 80 have dementia. And that number is only going to continue to rise as the baby boomers get older, and we'll get more into that as well. But right now it's 20%. So this is a very pervasive chronic disorder. And the first type of dementia that we are going to go in depth in class is Alzheimer's. Abbreviated AD. Alzheimer's disease is, again, a form of dementia. It's progressive, irreversible, and it involves the gradual deterioration of many different things, including your memory, language, reasoning, and eventually even physical function. So Alzheimer's disease will eventually kill you. It is a deadly disease because of these physical complications that come in the later stages of Alzheimer's. The earlier stages are definitely more focused on memory symptoms. The later stages have more of that physical function. Currently, there's about 5.2 million people who have Alzheimer's here in the country. And again, with the baby boomers and increasing rates of dementia, they think that it could potentially get up to 10 million with the baby boomers getting older. And there are two different types of Alzheimer's. You have early onset. If you have early onset, it is before 65 that it appears. And we've talked about this potentially earlier in class, how even though it's early onset, that doesn't mean it's popping up in your 20s or 30s. Remember, a lot of these more chronic diseases tend to pop up after reproduction ends as you get older. So early onset is just before 65. Late onset is after 65, and that is much more common to have it after 65. And the cause of this is a deficiency in acetylcholine, which is a neurotransmitter connected to memory. And we will go a little bit more into details on a genetic component with that that could play a part in about a third of the cases. But acetylcholine plays a part. And basically what happens is that you get tangles and plaque in the brain tissue. And the TED video for this chapter connects with that a little as well. So you develop lots of tangles, lots of plaque. The most common way to diagnose Alzheimer's is actually after death by looking for those tangles and plaques in the brain. But they are working on a blood test to diagnose it earlier instead of just post-mortem. And again, we'll go into more details on what can cause this, the genetic versus environmental components, the MCI as a precursor in class. But the other form of dementia that you need to know about that we're going to go into detail in class is Parkinson's disease. That's also going to fit under dementia. It, again, is a chronic disease, which means it is chronic, and it is also progressive, like these have to be. So slow onset, but it's going to last a while. It's going to get worse. And what happens, the symptoms for Parkinson's disease, which can also be abbreviated PD, is muscle tremors. So you tend to have lots of muscle tremors. Michael J. Fox is a famous person that has Parkinson's, and if you've seen him recently, he does have that muscle tremor. You tend to have slowing movement. So for example, if you see Michael J. Fox speaking, he tends to speak slower now, almost slurred on occasion because of that slowing movement. And partial facial paralysis plays a part. And what causes Parkinson's disease, it's a different neurotransmitter that plays a part in this. So again, with Alzheimer's, it's acetylcholine, AA. For Parkinson's disease, the neurotransmitter that plays a part in this is dopamine. So basically what happens is it's a degeneration of the dopamine producing neurons. They're not totally sure why the neurons degenerate. The treatment for Parkinson's L-DOPA is fake neurotransmitter. It's fake dopamine. There's some issues with dosage for that. Again, we'll get more into that in class, but that would still fall under the dementia category. So these are the definitions to throw in your notes so you are fully equipped to participate in our class discussion. I'm not going to write all this down and give you all these details. So make sure you've got the chronic disease, slow onset, long duration, men more fatal, women more non-fatal, and your income plays a part in these. You have osteoporosis, more with women, especially if you are tiny and smoke. You've got dementia, the two forms, Alzheimer's and Parkinson's. Alzheimer's, it's the acetylcholine. Parkinson's, it's the dopamine. Alzheimer's, it's going to be more memory deficiencies. Parkinson's, there's more physical like paralysis or tremors involved. And that is all that you have to know outside of class for Chapter 4.